My talk is going to cover some of the current genomic tests that are in practice and use at the moment that determine either treatment or prognosis for patients with certain cancers. I then go on, because it's an evolving field, to describe how we're moving forward in terms of the evolution and what new tests are coming on board and how we've got there. So I talk about the 100,000 Genome Project and using illustrated examples of interesting cases to understand the wealth of treatment data set that's basically come out of the 100,000 Genome Project, and how we've used that to not only diagnose patients, but to offer different treatment options for them via new clinical trials that they wouldn't normally have had access to other than through this programme. And then I go on to talk about the whole genome side of things and how that's becoming standard of care, and actually using the legacy of the 100,000 genome, which has then driven forward us to a different place, and how we utilise that data in the new world, basically. And it will become routine for certain tumour types that they will be offered whole genome sequencing on top of the normal genomic tests that are currently offered as well. So it's in addition to, not instead of. And I think that's really important to remember. Initially, it's only 3 cancers that will be rolled out for whole genome sequencing, but this will absolutely be expanded as we move through. I talk about the new cancer test directory from the genomic side of things. This is a new test directory which has been put together and will be centrally funded by NHS England, and it has new targets on new genomic tests which will lead to better treatments for patients. And this is all moving forward at quite a fast pace. So then I talk about those new tests in more detail, particularly around NTRK inhibitors, and know the talk after mine absolutely covers those, so I'll just touch on it. But also, and importantly, of a new test that we've set up in the Northwest region, and the other genomic laboratory hubs are also bringing on board for DPYD, which is a gene where we look at 4 variants to understand if a patient has 1 or 2 of those variants, to give a prognosis how they will tolerate certain chemos such as Capecitabine and 5-FU. And what I do describe in quite detail in my talk is how we've set that pathway up across our geography, which is the Northwest. And for the first time, we've rolled out a genomic test, which is a rapid turnaround on a high volume across the entire Northwest. And that for us includes Greater Manchester, it includes Cheshire and Merseyside, and also reaching up into Preston and Lancashire. So it was really, we covered new ground with that as a GLH, and we've managed to successfully deliver on that test. And I'll talk about the testing pathway, how we set it up, how it was a multidisciplinary approach with pharmacists and biochemists to get that test on board. Because one of the key things when you set up a new cancer test that directs treatment and has to be in advance of any treatment being prescribed, any chemotherapy, is that test result has to be in the right place, and it has to be there quickly, and it can't be emailed or delivered to individual consultants. It has to be a centralised point of contact, and we've been able to deliver that, like I said, across the geography. So I talk in detail around that. I talk about where we're going, so where we're at the moment. I talk about how it's evolving for the future and where the drive is, where we're expected to be maybe in another year or two's time, what the forward direction with a 10-year plan, forward plan for the NHS is, and how genomics features in that, particularly around personalised healthcare, about population screening, which will lead to treatments, around the pharmacogenomic side particularly. And finally, I talk about the turnaround times and how they are coming down on the cancer side of things for genomics, and that there is a vision and a hope and a strategy that going forward we'll be able to bring on board an expedited cancer testing pathway within the genomic laboratory hubs that will hopefully meet the turnaround time at 7 calendar days. In summary, that's in essence what I will cover. Some in more detail, some not as detailed, and hopefully you'll be able to see that the field, how we're evolving, and how having pharmacists on board and engaged and doing the comms with us will drive this evolution forward.